Well, the South African Medical Association has called on government to act decisively in making hospitals safe for patients and for healthcare workers. Now, this after a patient was shot and killed in a Witbank Hospital in Mpumalanga over the weekend. This is the second time a shooting has taken place at the hospital this year. Well, to further discuss this, we're now joined in studio by South African Medical Association's spokesperson, Dr. Mzulungile Nodikida. Thanks so much indeed for joining us and welcome to the program.
Yeah, thank you very much for having us.
All right, so I don't know where to start with this because it seems like I remember reading stories such as this 10 years ago.
Yeah. So this has been happening for a long time. And in our view, we think that the government, in terms of the security in hospital, has not kept up with the increase in violent crime rate. And they're not using data that is available to them to plan for these things. And this was happening when we had just taken a decision. We had a meeting on the 16th, and we had taken a decision to actually meet with the minister. And this is in the morning, and in the afternoon we get the information. In the Eastern Cape, about a week ago, a patient was stabbed to death when the doctors were busy putting up a chest drain.
Wow.
Now, our view is that there's information that the police release almost every year, and this information gives you the hot spots areas. So our view is that the government should at least plan accordingly. As we speak now, most of the guards in hospitals are not armed. And there is no, regardless of the area, there is no patrol by the police. I just wanted to give you an example with Ngcobo in the Eastern Cape, the hospital called All Saints. The area itself, the thieves broke into the police station. The police station about a year ago.
Wow.
So you can imagine an area like that. Obviously, the security detail in the hospital has to be different.
What would make you feel safer?
Okay. So the first thing is, this needs to be understood that some as members who are doctors, and in fact, I think all healthcare workers, their primary responsibility is to their patients. So a doctor is not safe if their patients are not safe. So let's start there. Now, we can't come here and seem to be advocating for the safety of doctors. There's primary safety is the safety of patients. So one is, if the government can change and use technology first to limit access. So access through the gate, it must be limited. And once you are inside the hospital premises, you can't just walk into the ward or into where the patients are being treated. There has to be some sort of a security measure that controls the access into where patients are treated. So you can use biometrics, you can use different things to make people gain access.
Is it safer at private hospitals? I mean, what lessons can we be learned there?
Look, I don't want to go into that space because I'm not sure if it's safe, because I think just recently in the Eastern Cape we had an incident where a patient was nearly raped in a private hospital. So, but our view is that especially the killing of patients, it has been in the public sector. Now, it is not just about that. There are incidences of attempted rapes in public hospitals. So it's been a long time coming, but this has pushed us into a tipping point to call this urgent meeting tonight. We're meeting with the minister tonight.
What are the authorities saying? What has minister been saying to you?
We're meeting the minister this
so up until now, the cases have been happening, they've been observed, there've been no responses at all?
Let me tell you. Let's make an example with Mpumalanga. Mpumalanga, not Witbank Hospital, Mpumalanga. We've got one of our senior leaders suspended there because he organized labor there to say, look, we can continue to render the services here. And the message that I think the department misinterpreted was that they are saying they don't want to work the doctors. No, they were saying remove everybody, remove the patients, because the patients are not safe. So it's not about strike or pulling out doctors per se. It's about guaranteeing, firstly, the safety of patients and the safe working conditions for our members. So that doctor is suspended there, and he tells us that several incidents have happened, and they've reported to the MEC, and nothing has happened. So that's why it's important for us to talk to the minister, so that the minister can give the MEC a call.
So, Denosa has been pointing the finger at one of the security companies, and I wonder if security, you talked about them not being armed, but could there be other problems associated with security?
Look, unfortunately, I can't speak for Denosa, even though they are our sister union. I really can't speak for them, but our view is that the way in which hospitals are guarded is old school. And they need more. I mean, you need to have, if they don't have armed guards inside, at least have a panic button so that they can press and immediately there can be an armed response that comes. So our view is that the whole way in which they are guarding the hospitals is not in line with the violent crime that we are experiencing in our country. And I think it's important also to point, my brother, that crime is a societal issue. So in our statement, we're actually even calling out on the community leaders and the communities themselves. Because you're not going to be able to attract doctors in areas where there are incidences like this.
All right, so, and I suppose it's a challenge for you because of the Hippocratic oath that you take. You have to treat these people, some of them are criminals themselves, and their fellow gang members, rival gang members, now come in and you're caught in the middle of this.
Yep. So, regardless of who you are a gang member, you're not, but when you come to us, you're a patient. And our business, we are in the business of saving lives. So we want to save that life. Now, society has to deal with this. Otherwise, we have a problem. You're not going to attract people into the hospitals in areas where there's high crime rates. And that's going to be a challenge, especially with this universal coverage that we're talking about in the sector.
All right. Well, we wish you the best of luck with your meeting with the minister. But it's one goes to a hospital to feel safe and get well, and if that becomes another place of danger, that's a very sad thing. Thanks so much indeed for coming through.
Thank you very much
for your time.